So it's very important that you know the maneuvers, because this is the breakdown. And like I said, it's really hard to learn overnight. You just have to keep learning it until you get used to it. It took me time, then I finally was able, because anytime I learn something, I break it down in a way I need to remember. So this is what we call the knee exam maneuvers. Whenever you are trying to check the knee. So if you look at it, the first one is your draw sign. So under the draw sign, we have two, which is the anterior draw sign and the posterior draw sign. So, and what is the anterior and the posterior checking? They help to check the anterior, because they help to assess the knee instability or ligament damage. So you see that the way they do it, from the video we watch, is either you move it like you are opening a drawer, or you are closing a drawer. So anterior, you are opening; posterior, you are closing. So anterior draw sign, posterior draw signs. And what will this thing check? Is going to help check what we call anterior cruciate ligament. Anterior cruciate ligament, which is the same thing, like we say the ACL or the PCL. That is anterior cruciate ligament. So when they ask you a question, what test do we use to check for ACL or PCL? Okay, ACL or PCL. That is your anterior cruciate ligament or posterior cruciate ligament, which
That
is
was
the
on my
same thing.
test.
Yes, anterior cruciate ligament and posterior cruciate ligament.
Yeah, they gave you Lachman and they asked you like you had to spell it out. You had to know which one it was.
Yes. So both of them, it has um anterior and posterior. That is what I want you to know. So the Lachman will check the anterior cruciate
Yeah.
ligament.
Yeah.
That is the integrity. Okay. So basically, the Lachman is the gold standard for anterior cruciate ligament. So another way I remember that is, I remember CAL. If you spell CAL backward, CAL, that is ACL. So in the exam, I didn't even need to memorize anything. I just see ACL and I turned it around. Is your Lachman. Lachman. So always remember that Lachman is usually used, the Lachman test is used to assess the anterior cruciate ligament, especially using the anterior drawer test. Please remember that. So what does Lachman check? Lachman check anterior cruciate ligament. Anterior cruciate ligament. What is the most sensitive test that we use to check for anterior cruciate ligament? That is your Lachman. So you can erase this one or you bring it up here. It's still talking about the same thing. So under Lachman, Lachman is used to check anterior cruciate ligament, and then they use what we call the draw sign, which is the anterior. But remember, we have both anterior and posterior. So anterior is like when you are opening the drawer. Posterior is like when you are closing the door. Then another maneuver that we have is the McMurray and Epley grind test. And the McMurray and the Epley grind, I say that both of them are the same in the sense that we use this to check meniscal tear. That is what is used to check both of them. But the difference is how it is done. It is how it is done. If the examiner asks you a question that patient is on prone position, like prone position, that means that they are lying down with their abdomen. I use P to remember prone. If the examiner said the patient is lying on the prone position, lying on the abdomen, then that will be aptly. But if the patient is lying down supine, using their back to lie down, then that is McMurray. But both the McMurray and the aptly, we use it to evaluate meniscal tear. So please, in the exam, if they ask you the one that we use to for the for the meniscal tear, please don't forget that is the what? That is the that is the McMurray and the aptly. Then another one is the collateral ligament. Collateral ligament, the same way that we have the broad sign, we have two, anterior and posterior. In your collateral ligament, we are checking two things. What are the two things we are checking? We are checking MCL, which is what? The MC, medial collateral ligament. That is the one that we call the valgum. When you are, some people call it K leg. When you are bringing it together, some use G to remember gum. Some people use G. This is valgum G here. Some people use G to remember glue, like when you glue it together, valgum. So medial, remember medial is bringing to the center. Medial is bringing to the center. So when I want to check for medial collateral ligament, what I'm going to use is the Vargus stress, or you can check for the lateral, lateral LCL, lateral. That is the one they call bow leg. Lateral is a way, and that is Varus. So please take note for the exam, because Varus is high yield. The other one is also high yield, both of them. So again, your draw sign, your so if I emphasize more for emphasis purpose, the valgum or the Valgus, I'll put it here. The valgum is the K leg, okay? G in the middle, gum, like you are gluing something together. Glue, valgum. That is the medial collateral ligament. Okay. Then if you are doing away, bow leg, away, that is what? Lateral collateral ligament. So please don't forget this. That is your knee examination. We started with draw sign, and I said that draw sign is broken down into two. Draw sign is broken down into two, just for more emphasis again, and so that we use it to learn. It's the same thing, but just for more emphasis. So we call this the knee maneuver. Just a recap of what we said, but it's the same information, so that you see if you follow what I said. So what did we say here? The first knee maneuver that we have is draw sign. So the draw sign is your anterior and posterior. So it helps you to check if somebody have a tall anterior cruciate ligament or posterior cruciate ligament. That is the draw sign. So when you feel like you are opening the draw, that is anterior. When you feel like you are closing the door, but you remember you are manipulating the knee, not the door, the somebody's knee, that is the posterior cruciate ligament. And that helps you to check for any tore in the anterior cruciate ligament. Then after that, we have another one, and the but three things I will remind you is that if you want to assess for knee instability, that is how they ask it in the exam. You want to assess for knee instability, you want to assess for ligament damage. What do you use? You can use the collateral ligament. You can use the collateral ligament, which is your anterior draw, anterior cruciate ligament, or the Lachman sign. They are talking about the same thing. Okay. Then the Lachman, I said to remember LAC. If you turn it around, ACL. So if I want to turn this around, is ACL. Then I don't have to memorize it in the exam. Once they ask me what is Lachman used for, I turn this around. I know it is used to assess ACL damage. And you must know the full meaning of ACL, which is the anterior cruciate ligament. Then I said another test that we need, we use it to test for two things. To test for meniscal tear, sorry, and those two tests is the McMurray and Apley. McMurray is, you are checking for meniscal tear, which is the same thing, but the only difference is that in McMurray, patient will be on supine position, but in Apley, P in the middle, patient will be on prone position. So please don't say that I didn't mention. This is very important and very high yield point. And it helps to, so you are going to hear that audible or palpable click. You will hear it. It's very obvious. Then the last is to checking for collateral ligament. If I want to check for collateral ligament, what do I use? I use two things. The MCL, which is the medial collateral ligament. The medial collateral ligament is like K leg. You are bringing it together. K leg. That is your what? Valgus stress. But if I'm doing lateral, lateral is a way. That is bow leg. Bow leg. That bow leg is going to check for what? Is going to check lateral collateral ligament. So please take note of this because it's very, very important. I know it's kind of confusing. So if you close your eyes and try to see if you can answer any of these questions, I will ask right now. So the first question, you can put down your answer, see how many you're able to get. The first question is, which test is most sensitive for detecting ACL? Put down your answer just to see if you're able to get what I said. Let me just, for teaching purposes, I can just put the question. So these are the questions. sample questions just to see what we covered now. So the first question, which test is the most sensitive for detecting ACL tear? ACL tear. So if you choose Lachman is the most sensitive. Lachman.
C.
So if you choose, write down your answer.
Mm-hmm.
If you choose, it's just a quick one to see how many we're able to get. So the answer is Lachman. I give you little time to answer. Then the next question, and remember that I said for ACL assessment, the Lachman is more sensitive and reliable than the anterior draw test. Okay, so that is why we do the Lachman. The anterior draw test can also be used, but Lachman is more sensitive. So that is your rationale, but I already said it. So the answer, the ACL, Lachman is more sensitive. So that is our answer and more reliable than the draw test. You shouldn't use draw test because draw is in it. Okay. Then the next question, a positive near test. We did that already. Suggests which condition. If you choose rotator cuff impingement, you are correct because we did that already. What does a Varus stress test assess? Vargus. Vargus. And this is how they write it in the exam. Vargus. What does it assess? So if you know the answer, I say that there are two tests that we use to check the collateral ligament, the medial collateral ligament and the lateral collateral ligament. The medial collateral ligament, which is the MCL, checks the valgus, which is the valgum. Bring it together like a K leg. Then the lateral collateral ligament is the bow leg. Audible click during McMurray test indicate injury to which structure? Number four, number four, that is the meniscus, meniscal tear. So if you get meniscal tear, you are correct. So for more questions, you can use the book to do more questions.